Good evening. This is Dr. Thomas Klein coming to you from Raleigh, North Carolina. I am the senior advisor to the National Pain Council, and the National Pain Council has developed a little document that we're going to share soon, publication number 054, called Better Words. Words are important when you're dealing with issues that have bias. Because the words can attach themselves with connotations. Junkie is a good word. Junkie. What a terrible thing to say. Dope fiend. All of these are words that convey information, negative information. So this little project, I'm just going to give you some examples from it, and if you wish, you can email us and we can send you a full copy. We recommend this for writers and journalists and anybody else that wants to try to find the truth. If you're trying to find the truth, you need to get rid of what we call pejorative words. Great word. Pejorative. Pejorative words. It means words that have negative connotations. So, let's see. Of course, we've talked about opioid. You don't ever need to use the word opioid because all opioids are pain medicines. So imagine reading an article and just substitute the word opioid and stick in pain medicine instead. And that's perfectly logical and perfectly okay to do. It's not you're doing anything nefarious. Highly addictive. We read that all the time in the paper. That's like being highly pregnant. Highly addictive, you don't need to say that. It's addictive. The drugs are addictive. As we mentioned, heroin that used to be sold in drugstores is addictive, along with every other pain medicine. It's a pain medicine, and it's used in other countries as a pain medicine. And because it was attached to the devil, it was made illegal here in 1924 because it didn't want to cause more addiction. Well, that didn't work. Palliative treatment. That's an important word. It's in the CDC guidelines in the first sentence, and it says if you're getting palliative treatment or palliative treatment, none of the guidelines apply. There's 10 million people with rare painful diseases that need to take opiates every single day, 24 hours a day, but they're excluded from the CDC guidelines. Palliative treatment. Every single patient, every single member that's reported back to us when they brought this up with their physician, the physician said, oh no, palliative treatment is only for those at the end of their life. Not true. And we have a document that we're working on, we can share with people soon, explaining this. Palliative treatment is simply taking care of somebody when you can't deal with the disease itself. Simple. That's what doctors have always done. If you come in, you got a disease, and say, well, George, I'm afraid there's nothing we can do. And then you say, but we can certainly still take care of you. You know, there's nothing we can do directly for the disease. We can make you comfortable, which is a term I don't particularly like, because what palliative care is treating distressing symptoms, which insurance companies pay for. You can put the symptom in the diagnosis column and get paid for it. So it's so bad that palliative treatment really has a negative connotation. So we can say humane treatment. And that's the word we kind of are using now. This is humane treatment. It's normal. Doctors and nurse practitioners have been doing this their entire careers. But it gets you off the CDC guidelines. Yeah, important. Misuse. That's a charged word. Misuse. See, what that's doing is conflating addiction and treatment, because with addiction, you are misusing the drugs. And so if you misuse them over here, then you must be an addict. Well, the federal agency called SAMHSA, which is the SAM, a Substance Abuse and Mental Health Agency, another federal agency about drug abuse. There's several. They described misuse up until 2015, as using medications for uses other than for disease. Makes sense. Then they changed it to using your medication other than what it says on the bottle. Well, with pain medicines, you have to vary, and doctors don't understand that. You can't take one pill every 4 hours all the time. Sometimes you don't need any pill. Sometimes you need 3 of them. So when they go around with their little computers and pay $35 to people to do these surveys, they say, have you ever taken a pain medicine different than what it says on the bottle? Like everybody has. So what they did is they very cleverly doubled the number of people misusing their drug. And who misuses? Addiction people. So now they doubled the number of people that fall under their jurisdiction and got more money. So we don't use the word misuse. We use the word using it and then describing how you use it. Escalation, that's a pejorative word. As doctors, we don't use the word escalation. You know, if I need to give somebody more penicillin because they're not responding to the antibiotic, I don't say we're going to escalate your dose, increase your dose. So instead of using the word escalation, we use the word increase. Okay, he takes drugs. What kind of drugs? These are pharmaceuticals. All except heroin are prescribed. Even methamphetamine and cocaine are prescribed, although not very often. So why don't we just say, if a person takes drugs, you say, he takes methamphetamine. He takes cocaine. He takes pain medicines. Or all the other drugs that are available, ecstasy, and people are back to taking LSD. So we need to stop saying things like, he takes drugs. Chronic pain, that's also a pejorative word, because in the CDC thinking, chronic pain means you're taking it for a long period of time and therefore you're going to become addicted to it. 25% said the PROP organization in testimony in court. And in fact, it's not 25%, it's 0%. As we've discussed, after you start taking it, then you can never become addicted. Skyrocketing. Boy, that's a term you see copied from newspaper article to newspaper. Skyrocketing. Why don't you just say what the percentage increase is? Opioid stewardship. Boy, that's a nasty one that's come along. Like you're taking care of a forest. You know, like you're the steward of a forest. That's a terrible phrase. We don't use that at all. Aberrant behaviors. Aberrant. What a word. Aberrant. The pain patient was showing aberrant behaviors. What are aberrant behaviors? Over here, those are behaviors that people with addiction disease have, like stealing, and but they include all things, you know, that heroin addicts have. And if you have one of them over here as a pain patient, aberrant behaviors. A lot of this is trying to predict who it is that's really addicted to the pain medicines. If a professional can't figure out a person who's addicted to pain medicines, they need to go back to school. You don't need tests and checklists. Getting high. High is kind of a four-letter pejorative word. Now, if a person goes out and drinks alcohol and feels flushed and feels disinhibited and feels better, is that a high? It is, but people don't say it is. So rather than saying high, which is a four-letter word, say altered thought processes, inebriated, he was stewed, toasted. Use the words that are used for alcohol excess because that's no different for other drugs. The big difference is the word with dependency, and we're going to have a special session on that because it is such a bad word to use, and we try to avoid it by saying chemical dependency. Well, that's all we have time for. This is just some examples of our publication. I mentioned this is number 54, called Better Words, and this will be available soon. You can email the National Pain Council at gmail.com and put on the list, and we'd be happy to send you a copy. I will see you next Monday, and I'm not quite sure what the topic is, but I'm going to be working on it. Good night.